Well, good afternoon. Hope you had a great day. I just flew in from Belgium. As was introduced, I did work in pharma for 25 years. Well, I worked inside of pharma for 15 years, and now for the past 10 years, I've been inspiring and advising pharmaceutical companies around the globe. Basically, work with all the top 20 companies, very often at the global level. What I try to do is I try to bring pharmaceutical companies into the future, think about how they should change or how they could be changing. And that's exactly what I will try to do here as well. I'll talk about how medical information, medical education actually is evolving, and definitely in the era of AI that we are seeing here. This is basically what I'll be doing. I've been introduced 15 years at Pfizer, won a couple of global innovation awards there. The thing was that very often when I was working in a company, and maybe you experience that as well, if you innovate something, it's very hard to do because things don't move that easily. And after 15 years, I had this feeling that I wanted to achieve a little bit more on the outside, and that's why I left. Basically, what I do on a daily basis is look at how the world is changing. I have this one belief that health and happiness is the most important thing for all of us. Maybe let me just quickly check that. Who does not want to be healthy and happy? See, so everything that I do is always the same thing. I look at how the world is changing. I look at how that impacts our health and well-being. And I also do the opposite. I look at how we behave around our health and well-being and how that changes things in society and business and so forth. When I analyze these things every day, I write newsletters about it once every 2 weeks, who end up then in books. I've written 2 books. First one is called Healthenthusiasm, which explains why people are more than ever occupied with their health, what that means for companies, and not just for pharmaceutical companies, but I also work with supermarkets, I also work with food companies, home builders, DIY companies, and so forth, and I explain them how they can evolve into becoming a health business as well. And then finally, my last book came out last year. It's called The Transformation Economy, where I try to think about how can we go from being a transactional business into becoming a transformational business. How can we actually move away from pure treatments to actually becoming a business that is focused on health outcomes? This is basically what I do. But today, I'll talk about this, of course, transforming medical education in the era of AI. Just a quick disclaimer, I'm not a specialist, I'm not a medically trained, I'm a business economist, I'm a strategist. So the examples that I'll show you are perhaps not the best examples. The examples that I show you are not all the examples that exist. What I'll try to do is I'll take you along the way. I'll try to explain to you how the world has changed in the past 20, 40 years and what that means for the future to come. This is what I will do. Is that clear? Just to be sure. But first, I'd like to take you back to the era before the 80s. It is before these people made healthcare and medical very popular on TV. It was a time where cigarettes were sold like this, and where you can actually buy cigarettes bedside in hospitals. This was the reality back then. And patients, the only thing that they did, they were mainly thinking about, should I take my pill or not? They were not really vocal. But that changed pretty quickly. Before the 80s, there were 2 forces that were shaping health and care, 2 very important forces. And I'll explain to you today what these forces were and how they have changed over time, because this is a very important change that we need to realize, and it's being accelerated by AI. And the first force is the fact that information was not evenly distributed in the world. You can already see that if you look at the Hippocratic Oath. Before the 80s, what it did not mention was patient autonomy. There was no informed consent. Basically, a physician was free to decide what to tell to his patients, depending on how important he felt that the patient, whether or not the patient should know it. After the 80s, that changed quite a bit. There was more respect for the patient, and it became more of a collaborative relationship instead of a paternalistic relationship. And that's very important because people really want to have more control over their health. Unfortunately, still today, the reality is that patients do not really know what is happening with them. And because of that, we think that this is changing, that we have this phase of moving away towards maybe a world that has evenly distributed information, but it is not really the case. Although things have happened. Dr. Google came in the early 2000s, and today 50% of the people are actively involved in finding information online. 82% have done it, of all the people around the globe. That's how important it is. People are looking for that information because previously they did not have that information, and obviously it led to this. You may have seen this before, and certainly in the beginning in the 2000s, I mean, physicians really did not like it when people came to their offices with questions about things that they've seen online. But still, it is there. About 1 billion health-related searches online today. That's how important it is. People are looking for that information, and that information is to be found. It makes them informed before they go to the physician. It makes them empowered after this. And I'm pretty sure in your companies, you all have websites that physicians can refer to. This is what happened. People are more empowered. The information is more equally distributed. And it happened again in 2010 with social media. 93% of people engage with health-related content on social media. 40% say that they actually change their behaviors, even if they have chronic diseases. This is what we see. Nevertheless, 2.1% of the health-related information on social media is actually in line with what we see in the health standards. Now, public health standards may not always be up to date, let's be clear, but 2.1% is not a lot. Then again, 57% actually rely on this information. So what we see is that people are looking for information because they really need it. And right now they're in a balance between what is the authority that we find in information online and what is the social proof that maybe we can see in social media. Things are changing really fast. People are looking for information because previously it was not evenly distributed. With AI, this will change even more. Right now, there's 32% of the people that say we go to ChatGPTs to actually find health-related information, which is quite a lot. And if you look at what ChatGPT can do, and this is the results from ChatGPT 4 or even the last one, ChatGPT 4.0, it says that it can really provide some valuable information, medically correct information. Obviously, this is just one picture. There's a lot of buts here. But what I want to say is that we are heading towards a future where these types of AI tools can actually provide a lot of information to patients. And actually, AI will become Dr. Google on steroids. If physicians were very unhappy with the fact that people came to their offices with information they found on Google, this will change a lot with AI. And what we see now is that all these companies, and you may know a couple of them, Apple, Google, Microsoft, Baidu is from China, DeepSeek, Kurai, Ada, Babylon Health, Bauer, Panasonic, Alibaba, all those companies, they are building virtual AI doctors. All of those. One that I really like is the one in China, which is Confing and Qingji, something like that. And it actually mimics, it has built virtual doctors based on real doctors. It looked at their profile, looked at their publications, and what people can do, they can actually have their medical exams interpreted. They can have reminders for medication, but they can also have AI-assisted consultations. So they really can have a conversation with virtual doctors already today. And all of these previous companies are building exactly the same thing. This is what we're seeing today. So, yeah, patients, they may not know what happened in the past, but right now they really start to understand what's happening. Probably even sometimes better than the doctors. Because if you look at, and if you ask doctors what is happening, many of them are concerned that patients will believe AI way more than themselves. So this is the reality that we're heading. There used to be a past where information was not evenly distributed. Right now, thanks to internet, mobile, social media, and AI, information becomes a little bit more evenly distributed. So what we have is that the healthcare industry really needs to accelerate things, because otherwise we're really going into an infarct. And luckily it is happening. If you look at how physicians go about the internet, already in 2003, 88% of the physicians were online. They were using it, which was lovely. Medscape started in 1995. Already in their first year, they had 40,000 people that were registered to go online, and there were only 4 specialties on it. Today they have way more, 13 plus million healthcare providers with 33 specialists, but this is how important it has become also for them. They need to find that information, because previously also for them the information was not evenly distributed. PubMed, same thing, 5.5 online searches every day. People want to have that information, and it is available. Instead of going to conferences, they have it on demand. This was the internet. Same thing with social media. Physicians realize, and they admit, that being able to work in a global network is very advantage for them, provides them a great advantage. Why? Because there's about 20% of their cases that they cannot fix. So that's why they're looking into things like Figure 1, which is the Instagram, if you will, of healthcare, where people or physicians share pictures and ask others to solve it, to find those cases, to solve those cases that they cannot do. There's about 1.3 million healthcare providers that are present on CERMO in 150 countries. So we see more and more that also physicians look for that information that previously was not evenly distributed. And the same thing is happening now with AI. If you asked in 2024, at the end of 2024, to US physicians, are you using AI in your practice? 66% said yes. The year before it was 38%. So also there, physicians are looking for that information. And we see a lot of things happening. Integrations with Epic, where you can have subscribed conversations, where you can have some advice, where letters can be sent to patients and so forth. There's decision supports, and where you actually have pre-built pathways, and based on the information that you put in about patients, that immediately it says where to go. You have obviously diagnostic support, definitely in radiology, but also this is for stroke. Been approved already in 2017, helps physicians to understand what to do when something happens. First of all, it is with less uncertainty that they will not be found, but also it will immediately trigger an action afterwards. And then you have, of course, the MedPalm 2 by Google, who is working now together with MyOpinion. MedPalm is a ChatGPT, if you will, that is trained on medical data, which means that it's a way more powerful and way more accurate than ChatGPT could actually be. And what we see is that if you ask it open questions, 8 out of 9 times it performs better than regular physicians. And this has been tested by physicians itself. What you see is that the only thing where MedPalm is performing worse is that it provides too much information. But even physicians, and this is evaluated by physicians, they say that actually physicians might have bigger harm or a risk to bigger harm than MedPalm 2. Again, obviously these are results. This is one test. You see other tests, they might say a little bit different things. The most important thing here is that the world is changing, and what these LLMs can provide you is very exceptional. But we're still kind of like in an era where we treat AI a bit like the GPS a while ago. Think about how we used to treat the GPS. In the beginning, when GPS came about, when it was telling you to drive right, very often we would still go left because we knew that maybe left was the better road to take, right? And I think in healthcare we're still there. Today, if we drive with a GPS, we don't even know where we're driving because we blindly follow it. So we're in that in-between phase where we most of the time trust it, but we're a little bit wary. We still go left if it says to go right. But this is all changing very fast. And thanks to, again, internet, social media, as well as AI, what we see is that the situation where the information is not evenly distributed because of geographical, institutional, economical, technological, or language barriers, what we see now is that this is all changing. We see that there's more and more equal distribution when it comes to physicians. Physicians has more access to whatever information that they might want to have. And the same thing is true for patients, as we said earlier. thanks to internet, thanks to social media, thanks to AI more and more. This is where we are. There's two forces. This is the first force that was very dominant before the 80s, which is changing right now. We no longer have this unequal distribution of information. But there's a second force that we are seeing that is radically changing, and that's the distribution of solutions. Because indeed, solutions now become more and more evenly distributed. Patients say, instead of, yes, I know now, they say, I know what to do. They know what to do based on what they can find online. Think about it. I know is anybody a runner? Yeah, 2, 3. A lot of people, if you compare it with, again, before the 80s, what you did, you put on your shoes and you went running. Right now, you have a ton of information available that allows you to run very specifically. You know what shoes to wear, you know how your balance is, you know what to eat. If you're training for a marathon, you know exactly at what minute precisely you need to eat before, during, and after. You know what to eat. Everything is, thanks to technology, very valuable. We have the solutions at our fingertips to have that impact, to have an impact. And I always say that running has become this form of personal science. Anybody who runs here runs differently, has different shoes, has different insights, knows what to eat, knows what to do when he or she has slept more or less that day. It has become a personal science, and we see this happening more and more in different areas as well. This is Dave Asprey's major trick, if you ask me. But he has 1 million followers, and he motivates people to hack their own biology. He really wants to make sure that people test and find ways to live 180 like he wants to do. Then you have this nice gentleman. You might have heard of him. He is somebody who invests about 2 million euros every year to do a lot of things. And actually, he's my age. He's 46, and he wants to become 18 again. So he does a lot of things to actually have that impact and become young again. Those two people have an impact on people. They've turned every one of them that follows them online into personal lab rats. Because what they're saying is that do also some tricks. This is what we've learned. Maybe you should do it as well. Maybe these supplements work. Maybe this exercise worked. Love the example is Tim Friede. He was living in Guatemala, realized that the antidotes for venom from snakes, actually they don't work. And it's very hard to define what needs to be done because there's so many venoms. So in the 2000s, he started letting himself bite by snakes just to make sure that he understands what is happening. Led to a coma of 4 days in 2001, but he kept on doing it for 18 years. And now his blood has all the antidotes of about 850 different snakes, which will now be turned into a medication. People are doing things themselves. Anybody knows what this is? Working in diabetes, anybody? This is the DIY artificial pancreas. 2016, Daniel Lewis said, you know what? Sometimes we're type 1 diabetes, and at night we're very afraid because we're not quite sure how our glucose is going, and we might perhaps even die. So what we want to have is a continuous glucose meter who immediately pumps insulin when we need it. Didn't exist. Too risky to build as well. They did it themselves. Put it on Twitter, created a GitHub, which is a place where you put the codes, and everyone started doing it. There's about 2,500 people within the year that tried this out, built their own app to actually have this continuous glucose meter. It was 3 years on the market before Medtronic was able to do it. This is what we see. People are trying to build their own solutions. They have the solutions for it. You know, genetic engineering, you can buy a kit for you at home for about $100, and you can try it. If you don't know how to do it, there's beginners classes you can learn online how to do it. Still not sure how to do it, there's biolabs everywhere where you can actually learn from citizen scientists, as they call them, hobbyists, to learn how to go about this. We see more and more how patients actually take things in their own health, how they actually have information and tools to build solutions as well. And this is even before I talked about AI. Because what AI can do is AI can actually look at all the data that you gathered with all these types of devices that many of you might have, and it can actually have this sort of R&D loop. It can tell you exactly what is happening. I did recently. I had a recent blood, exam. I put it into one of the AIs with all the blood exams from the last 10 years and looked at the evaluations, what happened, what changed, and so forth. What would recommend just to testing it. This could be done on a continuous basis with specific AIs. It's not that hard to do. You can then have recommendations on how to optimize your health specifically for you based on all that data that it is gathered. And those things exist already. Shiseido, actually what they did is they made a device that if you take a picture with your smartphone and it looks at the environmental data, it looks at the weather, it looks at your sleep, that is also available in your phone, it will put out a specific cream for your skin that you would need for that day. 80,000 different variations are possible. Same thing with the Panasonic. It takes a picture of your face and it will build a specific smoothie depending on how your face is looking. There's a ton of examples that are working towards NS1. Is it medically relevant? Is it medically correct? Sure not. Not yet. But it goes that way. There's exercise fitness devices that to the microgram can actually adapt itself depending on how you feel and how your muscles react. There's ventilation systems that adapt themselves based on your emotional state. There's cars that adapt themselves. There's more and more things that happen N is 1. And with AI, this will radically increase. And then specific AIs trained, or who might know perhaps to what you really react, could be the ones that nudge you in the best possible way. They become the synthetic relatives. Others might guide you through the healthcare system, might help you with finding the right information from your insurer and so forth. So where we're heading to with AI is that we were building a swarm of AI agents around patients. All of these things can be done with AI agents. Sounds futuristic, but within 3 years, it'll definitely be there. Probably within 2 years, you'll see already a lot of those things happening. Meaning that every one of us will have advice from one type of AI agent who will build upon your data, build upon the things that it learned from you, the right information to you. Which is quite interesting, I think. But physicians will do exactly the same. They will have a swarm of AI agents as well. What they will do is, it's endless. I mean, it could help with diagnostic. Even before the signs are even visible, AI will be able to detect something. There could be treatment planners based on guidelines that are adapted automatically, and the treatment comes immediately out of it. There could be execution, a bit like the nurse, the AI nurse that looks at how is the medication administered. Is it good? Is it go? Didn't we forget anything? Is it in time? There could be a very sensitive watchtower that looks at your patients and says like, oh, this is happening. We might have a deterioration here. Even if it's already very small, it could already be noticeable. It could translate information that you otherwise would give in a certain way, taking into account the health literacy, taking into account the education, the language of patient use. It could actually, do all the regulatory stuff, the administration, the protocols. It could take care of that. It could help with guaranteeing the quality, or it even could help you at the end of the day by saying, this is what we've learned. There will be a swarm of AI agents around physicians as well, very soon, who will help them do all these things. And what we will see is that the different AI agents will talk to each other. The AI agents from the physician and the AI agents from the patient will start talking to each other. Probably a lot more than real humans will talk. If you listen to what Zoom is saying, or what Other is saying, or even Teams is saying, is that we will have more meetings, maybe that's a good thing, with AI. Your AI agent will first talk to your AI agent to see if they can figure things out based on their information before you actually meet, just to make things go quicker. And this is what we will see in healthcare as well. So all of this is transforming medical education in this era. Because before the 1980s, what we had was basically two things. There were two forces that were shaping that era. One is the unequal distribution, the uneven distribution of information. And the second one is the uneven distribution of solutions, right? What I showed you is that we are heading towards a future where both information and solutions will be more equally distributed. Will it be as radical as I put it on the slide here? No. But will information and solutions be more equally distributed? Yes, for sure. This is what we see happening. And medical education in that regard will become a real-time, action-oriented, progressively evolving, largely automated discipline that drives everything in healthcare. Because AI will be based on data that's constantly evolving, and this will actually change the entire medical education. What does it mean for medical affairs and pharmaceutical company? Three things. We need to realize that AI will reshape everything about HCPs, how they learn, how they decide, how they interact. And it will go at a massive speed. And the challenge for you guys will be to keep pace. Because what we've seen is that indeed, internet, it picked up rather quick. Social media, healthcare, it picked up rather quick. And again, with AI, it picks up rather quick. So it's really important to keep pace, which is a big challenge. Now, AI will also turn data into immediate action. And your role will be to make sure that this is done properly, right? As you are already doing today, but it will have an accelerated impact. So it will be very important to look at these slides to see if this is all the AI agents that a physician might have or use at a certain point. Where is it exactly that you can play a role? Where is it exactly that you can chip in? Where can you help that physician? What can you provide to that physician? A bit like you do today, but in an AI environment. Now finally, AI will be everywhere. And even your sales force or the ones that go speak with physicians, they will have AI updated information. By the time they get to a physician, it might be different information that is available than was 2 hours before. Because AI will go that quick. And so in a way, you would need to have as well a swarm of AI agents to help you out. Because that is how AI will impact medical education in general. If I make it really crisp and simple, AI changes fast, so you would need to keep pace. AI accelerates the impact that data can have, that healthcare can have. And it's up to you to find ways to make sure that that quality is preserved. And AI will be everywhere. I always compare AI to electricity. If people ask me how will AI impact one or the other business, I always say, well, you can't ask that question. It's like asking how will electricity change your business? It's the exact same question. It will be everywhere, it will impact everything. And so it's really important that definitely in the future of your business, I know, in my opinion, medical affairs is already the central nerve system of everything within pharma, but it will need to be even more the case. Because everything will be driven by these healthcare and AI-driven data. And you might want to think about how you can build that swarm of AI agents to help you in that. That's how I believe that medical education will be transformed in the era of AI. My name is Christophe Jauquet, and I thank you for your